Everyone is now cautious about their weight, and it is actually important to be cautious about your weight. It is important to attain and maintain an ideal weight. And how do you do this? There's what we call the body mass index, where you get your weight and your height, and this will guide you to know where you are in terms of your weight, whether you're within what is required or you're under or over. When you talk of what is ideal BMI, it should be between 18.5 to about 24.9 kilograms per meter squared. And when you have underweight, it is below 18.5. So when you're below 18.5, then it means you're underweight. And then when you're overweight or obese, it is above 24.9, say 25. So between 24.9, say 25 to about 30, that is overweight. Above 30, then we call it obesity. And we know that nowadays obesity is regarded as a disease. And why is this? Obesity or overweight is not good because it puts you at risk of some diseases, which we know. One of them would be diabetes type 2, which we call insulin resistance. Another one, you might be at risk of diseases like hypertension, cardiovascular diseases. And when you talk of cardiovascular diseases, then some people may want to know more about cholesterol and how to maintain, how to be within the cholesterol that is required. There are also diseases like the fatty liver disease, kidney diseases. All these, they are intermingled, because when you have the insulin resistance, then you might have a kidney disease and all this. So these are the risk factors. How about when you are underweight? When you're underweight, then you might also be at risk of opportunistic diseases, because your immunity might not be, well. So opportunistic diseases might be your risk. In children who are underweight, of course, now in children we do not use the BMI per se. We might want to use what we call the Z score to know whether the child's weight is what is ideal. Then they are at risk of diseases. Of course, we know diseases like marasmus and kwashiorkor. Of most importance is the cardiovascular diseases, which we see are so rampant in our current generation. And cardiovascular diseases are many. You can talk of heart, cardiac arrests, and such.